Welcome to HealthCast, the heartbeat of health IT. I'm Alexander Bolova, production lead at GovCIO Media and Research. With me today is staff writer researcher Jayla Whitfield. Hi, Jayla.
Hi, Alex.
You had the opportunity to chat with Spyros Kitsiou, Associate Professor of the Department of Biomedical and Health Information Sciences at the College of Applied Health Sciences at the University of Illinois at Chicago. I'm also seeing that another title is Associate Chief Research Information Officer, Officer of the Vice Chancellor for Research. So a lot of titles for Spyros. Tell me about your guest.
Yeah, it was a great conversation. He definitely is doing a lot, but it's a lot of great stuff. His expertise is in telehealth and the development and testing of mobile health technology interventions for patients with chronic diseases and other conditions. So we talked a lot about the rapid increase in telehealth since the coronavirus pandemic, cybersecurity, the adoption of security programs for health ecosystem, and the challenges also around mobile health technology. But yeah, it was a great conversation. We got to dive into so many different topics just because he does an array of different things.
That sounds really interesting. So tell me a little bit more about how telemedicine and cybersecurity are working together, because obviously it was a necessity when the pandemic started, and now it's something that is very much a daily part of our lives. But I think a lot of people using those services aren't really thinking about how their personally identifying information is being protected in the cyberspace. So what'd you all talk about?
Yeah, so within the healthcare ecosystem, cybersecurity is huge overall just because there's so much data and that data is sensitive. So, what we had a chance to discuss is how to address those concerns related to data security and patient privacy in the development and use of healthcare apps and technologies and wearable devices. So, making sure that security is top of mind when using those devices and in the process of creating them.
Building in that security from the start, I know that's a concept that we very highly advocate for here at GovCIO Media and Research. So I'm glad to hear that was part of the conversation. Well, let's not keep our listeners waiting. Let's take a listen to your conversation.
Thank you guys so much for tuning in to HealthCast this week. This week we have a special guest, Spyros Kitsiou. He is an associate professor and director of the mHealth Innovation Lab in the Department of Biomedical and Health Information Sciences at the University of Illinois at Chicago. He's also an associate chief research information officer in the office of the vice chancellor for research at UIC. And I just want to say thank you so much just for joining us and taking the time today.
Thank you, Jayla. Thank you for the invitation. I appreciate it.
Of course. And I know you do research that focuses on several different capacities. Could you just talk a little about some of the work that you do and what you focus on?
Sure. So my research focuses on development in evaluation of novel and culturally appropriate digital health interventions, primarily for chronic disease management, but also for promotion of healthy lifestyle behaviors.
Definitely. I know that telehealth, mobile health, those are definitely big topics right now in the health ecosystem. So, how have you seen the landscape of telehealth and mobile health technology evolve over the years?
Well, telehealth and especially cybersecurity are two of today's dominant influences in healthcare. Both have evolved tremendously over the years. Before COVID-19, telehealth use in the United States was on steadily increasing trajectory, but its implementation and integration in healthcare services remained kind of low, primarily due to complex regulations, restrictions that were applied by the Centers for Medicare, Medicaid, and also private payers who were offering reimbursement for telehealth interactions. However, the COVID-19 pandemic kind of changed everything, drove a rapid increase in telehealth technology adoption to help patients access care during the pandemic. The health and the U.S. Health and Human Services, along with other federal agencies, eased a variety of medical licensing and privacy rules. So reimbursable telehealth services expanded, and the geographic barriers and platform restrictions were also removed. So this had a tremendous direct effect on telehealth practice. For example, telehealth use under Medicare increased tenfold from about, I believe, 5 million services from April to December 2019 to more than 53 million services during the same months in 2020. So during that time, we also saw a sharp increase in cybercrime. The U.S. healthcare industry noticed a 25% increase in successful cyber attacks during the pandemic. Now, to be clear, these cyber attacks were not specific to telehealth, but the increasing adoption of telehealth, coupled with a relaxed regulatory environment, made the opportunity for exploitation a very real threat. I know many of us read about ransomware and other cyber attacks on hospitals, and the sophistication and motives of these attacks. We have seen that have evolved over time. The crime itself has changed from one that is financially motivated to an act that also represents a threat to life that endangers public health. Cyber risk to the healthcare sector now more than ever is directly influenced by geopolitical climate. And in this environment, healthcare organizations and providers need to increase the cybersecurity at all levels. So as we now move into a new post-COVID era, the benefits, of course, of virtual care delivery will continue to drive adoption, but healthcare organizations need to continue adopting security programs to meet a new level of responsibility for the patients that they serve. For example, they need to deploy more mature analytics, better adherence to cybersecurity and privacy regulations, and also use data to show return on investments and maintain the drive for this significant telehealth expansion. Finally, it's important to note that the effort to protect hospitals and patients does not only rest with hospitals, but must include law enforcement, military, and intelligence assets, for their defense.
Definitely, that was a great breakdown. I know that with all of the mobile health, there comes challenges along the way. So, I guess, what are some of the key challenges and opportunities in the safe integration of mobile health technologies into healthcare systems?
Yeah, that's a great question. Mobile health technologies hold tremendous promise for improving healthcare and lowering healthcare costs, and also for promoting disease prevention behaviors. For those who are hearing the term for the first time, mobile technologies include smartphone-enabled technologies such as mobile health apps, wearable sensor devices, activity trackers, and other connected health technologies. So all of these have gained significant popularity over the last few years. But beyond the hype of the so-called mobile health or digital health and the whole wearable technology movement, the ability to remotely monitor patients' physiological measures and continuously gather data about heart rate, physical activity, sleep, diet, health status, even location and environmental measures, all these measures they create new possibilities for both biomedical research and clinical practice. These technological advances are kind of prompting new research approaches and medical approaches. However, they do raise questions and pose challenges for existing healthcare systems. So to speak about some of the opportunities, for example, from a research medical point of view, tracking and analyzing large volumes of, let's say, longitudinal data captured by these devices can help us reveal new patterns of biomarkers that might be informative of disease severity or progression. They can also help us open new lines of research inquiry, including development of more personalized behavioral interventions, and also fuel the precision medicine kind of approach and new treatments. So under the guidance of care providers, continuous monitoring with using digital health products could complement and eventually even supersede the established medical model that we have now of periodic testing for certain conditions. Now, in terms of challenges, an important challenge is the integration of heterogeneous and large data sets into current medical decision-making processes. So ensuring that these large volumes of patient-generated health data from these mobile and wearable devices are extracted, stored properly, harmonized to relevant standards, annotated or analyzed, and of course interpreted to yield clinically actionable information and insights to address research questions. That remains one of the most important challenges in the safe integration of mHealth technologies into healthcare system. Another important challenge that I see all the time in my field is kind of the need for developing the necessary evidence around the efficacy of mobile health technologies. There's a critical need for more research, including clinical trials. We need to test the efficacy, the safety of these mobile apps and these mobile technologies, such as wearable sensor devices, for various conditions and also in diverse populations. So this requires significant amount of time and investment. Sometimes it feels like we're playing a catch-up game, because by the time we establish some of these preliminary evidence, the technology has evolved and requires sometimes additional testing. So this is a critical challenge in our field, which I think underlines the need for development of new innovative study design methods to address this challenge.
Yeah, and I'm glad you mentioned the clinical trials and just studying this more. Can you share some of the insights into the clinical trials that you're currently conducting with NIH funding? And I guess, are the primary objectives of these trials, and how is technology being incorporated when you're doing these?
Sure, I'd be happy to. So currently, I serve as principal investigator or co-investigator on 8 clinical trials that are directly funded by the National Institutes of Health. In these trials, we are testing the efficacy of various biobehavioral and medical interventions using mainly consumer mobile health technologies that are commercially available in order to support self-management of chronic diseases such as hypertension, heart failure, asthma, COPD, and also to promote healthy lifestyle behaviors, including physical activity, exercise, and healthy diet. For example, in one of my studies, one of the studies that I direct, which is funded by the National Heart, Lung, and Blood Institute, we are conducting a factorial randomized trial to test the efficacy of a patient-centered intervention that combines well-known devices such as a Fitbit activity tracker, Withings devices such as smart scales, blood pressure monitor. We combine that with a program of individually tailored text messages to promote better self-care adherence in patients with heart failure. And the ultimate goal is to reduce hospital readmissions and mortality. So this is a very innovative trial because it's the first study that tests the safety and efficacy of using consumer-grade apps and devices for patients with heart failure. So I'm very, very excited about this study. It's a recently funded study, and it's expected to generate very important knowledge that will inform clinical practice and move the field of digital health forward. Actually, one other thing I wanted to note here, which has really helped us over the years. My research team and I have developed a digital health research platform that allows us to remotely collect, upon user authorization, large volumes of health data from mobile apps and sensor devices, such as Apple Watches, Fitbits, Withings, and other products. And we do that using web application programming interfaces. This kind of platform is a game changer because it has enabled us to conduct multiple biobehavioral research studies using consumer-grade mHealth products. And to just make it more simple for our audience, just to give them an understanding of how this platform works, basically it alleviates the need to bring the patients back to the lab for data extraction from these devices, or it alleviates the need to access individual accounts, which sometimes might be hundreds, depending on the sample size of the study, right, to collect the data. The platform is named iCardia and has been used now in over, I believe, 15 NIH-funded clinical trials in just the last 5 years.
Wow, that's awesome. And I know when you're doing these clinical trials and you're dealing with sensitive health information and health data. So, given the sensitivity of health data, how do you address concerns related to data security and patient privacy in the development and use of mHealth apps in wearable devices?
Yeah, that's a great, an important question. Thank you for asking this. A key consideration for all digital medicine applications, and of course for mHealth studies, is obtaining appropriate consent from users, from patients, and most importantly, explaining to them what the consent means. In terms of how the data are collected, how the data are released, accessed, and reused. And there are two different worlds. There's one, there's the clinical trial world, and of course, then there's the industry companies that create these apps and products. So in our clinical trials, as part of the written informed consent process, we explain to patients in simple terms what kind of data we will be collecting, where the data will be stored, how it will be protected, and of course, who has access to the data, and how the data after the end of the study will be de-identified and eventually be destroyed after publication of the results. Now, the industry works differently, but they still have to communicate to the end users how the data is stored and whether data is going to be shared. So I always urge the end users, our patients, I always urge lay people who use these apps, these products, to read the terms. It's very important to understand what's happening with their information. In the world of healthcare, patient health records are protected by the Health Information and Portability and Accountability Act. So as a covered entity, UIC and UI Health, we are obliged to following, to make sure that we adhere to HIPAA regulations. So the digital health solutions that we develop, such as the iCardia platform and other electronic data capturing systems we're using, are all hosted in a secure HIPAA-compliant computer environment. The systems are password protected. They use dual authentication methods for access and other security measures. Another measure that we implement, which might be of interest to researchers, when we use commercially available products, we create de-identified email accounts for study participants. And we also, in some cases, disable geolocation information to protect their identity from third-party companies. So over the years, we have built, necessary expertise, systems and protocols, procedures to minimize risk of data security and patient privacy, always in accordance with HIPAA regulations.
Yeah, I know it's so important, especially when you mention the cybersecurity concerns that increase after COVID. That's such a huge perspective. Are there any emerging technologies that you find particularly promising for improving patient outcomes?
Yes, there are many new technologies, which of course we're currently testing, but I truly believe they hold promise for improving patient outcomes. I mean, I could go on and on bringing examples. One example that comes to mind is, with the new wearable activity trackers and smartwatches, they have developed new sensors and algorithms that can accurately identify irregular heart rhythm or even episodes of atrial fibrillation. These newer technologies can play an important role in the future in terms of early diagnosis and treatment of cardiovascular disease. So that's one example that comes to mind. Of course, there are many other connected health technologies in the market that can help patients, for one thing, perform more frequent and convenient assessments at home, including continuous glucose monitoring systems that can help patients with diabetes self-monitor and manage their condition. There also exist smart scales that perform bioimpedance analyses, and we use this in our study to educate patients how to, keep track of their weight to identify early signs of fluid retention in their body. Another important technology, which I believe is poised to profoundly influence healthcare, is AI, artificial intelligence. In the area of mHealth, AI can be used, for example, to develop new services and tools such as clinical decision support systems or even interactive virtual health coaches to assist patients with daily self-care monitoring and management of their condition at home. overall, I think that mobile technologies have, when you look back, in previous years, they have transformed the social fabric of our life, and I think that they're now poised to profoundly influence healthcare and disease management moving forward.
Definitely, AI has been a huge topic across the board. Is there anything that we didn't cover that you can think of that you may want to mention or may have left out by mistake?
I think the one thing that it's critical in our field in the area of digital health is always, and we get a lot of questions about, is patient engagement and compliance in the context of using mHealth technologies. There are studies that have shown that patient engagement declines over time, and this is true. We have seen apps that have been developed by research institutions or by the industry, which actually are not successful. So there's always that question of how do you engage patients? How do you maintain that engagement in the long term? So a couple of things that I think are really important to highlight, especially for those developers, those who develop mHealth tools, mHealth apps, is the importance of using a user-centered design before you implement any kind of solution. You have to understand the needs of the patient population. You have to develop a solution that aligns with those needs and also with their daily life. Many technologies, especially apps, I believe, fail to do this and unfortunately end up being either too complex or perhaps not addressing the real needs of the patients. Therefore, they're abandoned, after a few weeks. So one of the things we try to do when we build interventions is to talk to patients and use a co-design approach. Then we have implemented also through iCardia, we have implemented various measures based on the data that we collect remotely that allow us to understand track adherence actually in real time and intervene in a timely manner using micro interventions such as reminders via text messages or vibrations on the tracker, motivational text messages, goal setting, and other successful behavioral change techniques. And actually, after we started implementing these measures, we observed high levels of adherence, both in terms of using the apps and devices and achieving the goals that the intervention is asking them to achieve in our studies. So definitely patient engagement, and compliance is a critical issue.
Definitely. I think that was perfect. I just want to take the time again and just say thank you for taking the time to talk with us and our listeners. We really enjoyed having you on.
Thank you so much. My pleasure. I appreciate the invitation again. You have a wonderful day.
Thank you, Jayla. That was a really fascinating chat that you had with Spyros. Before we let our listeners go, are there any last highlights or takeaways that you want to leave them with?
Yeah, I really enjoyed his insight on the different clinical trials that he's currently doing with funding through NIH. He's doing several different trials where he's testing out different apps and wearable devices for patients with chronic illnesses. So it was really nice to hear from someone on the actual inside that's working on this day to day. But yeah, definitely a great conversation. And I would love to talk with him again once some of those trials are finished.
Definitely. We always enjoy having repeat guests here on Healthcast and on our other podcasts as well. Well, Jayla, thank you so much. Listeners can tune in to a brand new Healthcast in 2 weeks. But in the meantime, if you like what you heard, make sure that you are subscribed. Please leave a review and a 5-star rating on the podcast platform of your choice. I'm Alexander Bolova.
And I'm Jayla Whitfield.
Thank you for listening. Healthcast, along with GovCast and Cybercast, is a production of GovCIO Media and Research. For more podcasts and to check out the other shows, head to govciomedia.com. Watch out for new episodes released every Tuesday and Wednesday across our shows. You can follow all of them on your favorite podcast platform And if you like what you heard, make sure to let us know by leaving a review. And if you have any topics you think we should look into, contact us at newsletter@govcio.com.